trigger warning. This is probably gonna piss you off.
All right, so 29 years of sucking fluids out of patients with suction. Do you think I know if it's working or not? No, don't talk back to me and listen. I don't give a fuck how long you've been a nurse. Your nursing is shit. You don't know when a sucker is sucking. I do. As a surgeon, I do. Goodbye. Dumbass. Let her go. Fuck her. You stupid bitch. You think a surgeon doesn't know when a sucker is sucking or not? Okay? This is not sucking. It has to be our goodbye. Goodbye. Get out of here. I don't know. I'll know in a few minutes. Okay? But a little suck is not suction. It has to be strong. Okay? When I say it's not working, it doesn't mean it's off. It means it's not sucking hard enough. There's a problem. That dumbass couldn't figure that out. How many times have I told her that?
Yes, I know, guys, it's hard to believe, but there's an actual live stream of a spine surgeon in the OR talking to his nurse that way, simply because the suction wasn't working, I guess, at the speed that he wanted it to. All you had to do was ask her nicely to turn it up. Like this stuff, you can literally crank it up if you need more suction. And I don't get what his obsession with sucker, suctioning, sucking, all that stuff. I'm not sure what that is all about. But all you had to do was literally ask, tell them to turn it up. You do not talk to anybody like that, especially your co-worker. You know what I'm saying? I don't care what you think your rank is, because, granted, in the operating room, the surgeon calls the shot, right? But at the same time, you don't talk to your colleagues like that. I don't care how pissed you are that they're not doing things the way that you want things done. All you have to do is communicate that, because you do not have the right to talk to anybody like that, especially knowing that you're on live stream. So if he is willing to do this while the whole world was watching, imagine what he would say or do behind closed doors, and then he had the audacity to still post that footage even after the live stream had ended, right? That man has some God complex issues, and whatever he is compensating for, you don't take that out on your co-workers. And I'm glad that this footage is actually circulating around, and I hope something is being done about this, because this happens way too often, and oftentimes nothing is done about it. Hospitals will tell you, oh, we can't find, surgeons are hard to find, so therefore they can act like assholes and get away with it. This surgeon right here, I think his name is Dr. Duke, or something in that nature. It should be Dr. Dick, but he deserves to pay for that. To be honest, I was actually impressed by how the nurse had handled that. She just walked away. She didn't make it about herself, because at the end of the day, the patient is the priority. And she handled that better than I would have.